Hello, welcome to TeleNursing EU project. I will be your virtual tutor. Let's explore Module 2 about telecommunication skills. Let us start. The general aim of this course is to empower telenurses and healthcare practitioners with the knowledge and skills necessary to deliver effective and safe care through telehealth platforms. Participants will gain a deep understanding of communication strategies, the challenges and barriers associated with telehealth, and the vital aspects of patient assessment and monitoring in a remote setting. By addressing these core areas, this course aims to enhance the quality of care provided through telehealth services. Let us review the objectives of Module 2. The first is active listening, reflective listening, and empathic listening in telenursing. Second is communication using technology, including challenges and barriers in telenursing. The next is safety and privacy in telenursing. Then is tele-triage, which refers to understand the concept of triage and explore tele-triage methods. Last is telehealth enrollment and patient assessment. The first sector of lesson referred to the types of listening in telenursing. Let us explore the definitions. Active listening is the practice of preparing to listen, observing what verbal and non-verbal messages are being sent, and then providing appropriate feedback for the sake of showing attentiveness to the message being presented. Reflective listening is a special type of listening that involves paying respectful attention to the content and feeling expressed in another person's communication. Reflective listening is hearing and understanding, and then letting the other know that he or she is being heard and understood. Empathy is the ability to understand and share other people's feelings. It is a core concept as, according to the psychodynamic, behavioral, and person-centered approaches, it facilitates the development of a therapeutic relationship with the healthcare user, providing the basis for therapeutic change. Let us discover the active listening methods. Paraphrasing is state the same information, using different words to more concisely reflect what the speaker said. Clarifying, invite the speaker to explain some aspect of what she or he said. Reflecting, relaying what was said back to the speaker to show that you understand how per second he feels about something. Summarizing, identify, connect, and integrate key ideas and feelings in what the speaker said. The second sector referred to communication using technology, including the challenges and barriers in telenursing. Communication in telenursing, while valuable and convenient, can present several challenges and barriers that need to be addressed to ensure effective healthcare delivery. Some of these challenges and barriers include lack of nonverbal cues, technical issues, limited physical examination, privacy and security concerns, language and cultural barriers, limited access to technology, distractions and environment, loss of personal connection, misinterpretation of information, legal and regulatory challenges, patient engagement, emergency situations, time management, training and education. Now, you will explore 3 key challenges in communication. Generational challenges that include technology literacy, adapt to patients' tech skills, communication preferences, tailor communication styles, tradition and values, respect and understand patient beliefs. Socioeconomic challenges that include language barriers, use interpreters and plain language for effective communication. Cultural beliefs and practices, respect cultural influences on health behaviors and treatment. Nonverbal communication, be aware of different cultural interpretations and ask for clarification. Cultural challenges that include access to technology, help patients find alternative communication methods or resources. Health insurance and affordability, provide information on resources and low-cost care options. Health literacy, use clear language and visual aids for better understanding. Let us continue in Section 3 about safety and privacy challenges. The challenges and impacts related to telehealth security and privacy can be categorized into 3 key factors: environmental factors, technology factors, and operational factors. Environmental factors, these encompass an individual's surroundings, living conditions, and social connections, all of which can have direct or indirect implications for privacy and security. Technology factors, these factors encompass various data security issues, such as the potential for hacking during video visits, Limited access to the internet and technology, the absence of digital devices, reliance on cellular data or public Wi-Fi, and insufficient digital literacy. Operational factors. These factors involve aspects such as reimbursement for telehealth services, monitoring payer denials for services, ensuring that telehealth technology is accessible to all patients, and providing adequate training and education for staff and providers. Additionally, this section covers best practices for ensuring privacy and security in telehealth. Developing best practices for telehealth privacy and security requires a comprehensive approach that addresses environmental, technology, and operational factors. The best practices for telehealth privacy and security are protecting patients' telehealth privacy, sharing secured information online, building privacy and security standards, ensuring reimbursement for telehealth services. As telehealth continues to evolve, health information professionals must address technology, digital literacy, and accessibility issues to ensure the successful and secure use of telehealth services for both patients and providers. Implementing best practice guidelines and policies is essential to meet the needs of all stakeholders effectively. In Section 4, we analyze the concepts of triage and teletriage. Triage is the process of determining treatment priorities for patients based on the severity of their medical condition, with the goal of identifying patients with life-threatening conditions and providing them with timely medical care. The role of triage is to establish the patient's primary complaint, decide on the urgency of the patient's condition, assess the time to the start of the first physician examination, and initiate treatment. Teletriage is similar to traditional triage in an emergency department but uses technology that alters the live interaction between the patient and medical staff. In this figure analyzing the whole process of teletriage protocol. Every teletriage should follow a protocol and assess the urgency of the patient's condition during triage. Here's a helpful diagram to better understand the triage process. It outlines the key questions that medical staff must ask during teletriage. In Section 5, we conducted an in-depth analysis of telehealth enrollment and patient assessment. The challenge in using telemedicine services often lies in assessing an individual's ability and capacity to utilize such technology. The primary barrier to the adoption of telemedicine is undoubtedly older individuals who encounter difficulties in navigating modern technologies such as smartphones, computers, or tablets, or many individuals who lack access to technology or reliable broadband internet, including those who are digitally literate and those who are not, individuals with disabilities, as well as those who are blind or deaf. Provide resources in various formats, including printed materials, audio recordings, or Braille. Ensure that your website and online tools are accessible. Telemedicine offers efficiency, accessibility, and chronic condition management benefits with various scheduling options. By addressing the digital divide, providers can ensure equitable telehealth access. Let us now summarize Module 2 on telecommunication skills. This module on telecommunication skills covers essential listening skills, empathic communication, and nonverbal cues for effective virtual care. It emphasizes patient engagement, collaboration with healthcare teams, and patient education for remote care management. Ethical considerations, safety, and data privacy are also addressed. Additionally, the module covers patient triage, video appointment acuity screening, and assessing patient capacity for successful telehealth interactions. Enrollment and patient identification procedures for remote patient monitoring and acceptance are outlined, ensuring a seamless virtual consultation experience. Overall, the module equips learners with vital skills to deliver patient-centered care and improve outcomes in virtual care settings.